nursing student from the University of Detroit, Mercy. I'm going to do your head to toe assessment here. So I'm going to close the door to provide some privacy. I'm going to wash my hands as well. All right, and can I get your full name?
Mahasa Patel,
And your date of birth?
July 29, 1961,
And do you know where you are right now?
in the hospital.
And do you know today's date of birth? I mean today's date?
April 1st, 2015,
Okay, and do you know who the president is?
Obama.
Any allergies
No.
to medications, not to latex?
No.
No. And do you have any pain today?
No.
Okay, so patient appears stated age of 53. Patient is alert and oriented ×4. No obvious signs of illnesses, and her affect and mood are pleasant, and her speech is clear. So we're going to go ahead and start her assessment. I'm going to feel for her skin here. Okay, patient feels warm, her skin is dry, and and her skin is normal for her race. And then we're going to go ahead and look at her eyes. Alright, so they are symmetrical. Her eyes are dark brown, and we're going to go ahead and have you look at my nose. And then you can follow the pen. Okay, so pupils are equal, and they are round. They react to light and accommodate to a pen. So pupils are perla, or eyes are perla. And all right, and we're gonna go ahead and check your conjunctiva. So conjunctiva is pink, sclera is white. And then can you smile for me? And frown, puff your cheeks. Okay, so smile is symmetrical, no drooping, and then cranial nerves 5 and 7 are intact. And I'm gonna go ahead and open up your mouth. Big ah.
Ah.
Okay, so her uvula raised, her tonsils are 2+, buccal mucosa is moist and pink, and the big ah again.
Ah.
All teeth are intact, don't see any cavities, and her gums are not reclining away from her teeth. And just soil. Okay, and her gums are not bleeding, no signs of redness or edema. And stick out your tongue for me. No coatings over the tongue, pink and moist. And that is all. So we're gonna check for your carotid pulse. All right. Okay, and the other side. Okay, good. Gonna go and listen with the bow. Big deep breath and hold it. And the other side. Breathe. Big deep breath, hold it. All right, and breathe. Okay, so bilaterally equaled at a 2+, and no brute sounds. Okay, and then we're gonna go ahead and actually check your skin here and your arms. So skin feels warm and is dry and normal for race, and then there is no lesions or lumps. And then I'm gonna go ahead and feel for your brachial pulses. So just have your arms straight out. Yep. Bilaterally equal at a 2+. Radial pulse. Bilaterally equal at a 2+. And we're gonna check for capillary refill. Less than 3 seconds. And then I'm gonna have you put your thumbs together for me there. No signs of clubbing, And then can you go ahead and pull on my hand? Yeah, there we go. Squeeze one more time and pull. So hand grasp is strong, and we're gonna go ahead and listen to the lungs. So we're gonna listen to 10 spots in the front, 10 spots in the back, 2 spots on each side. And this will be with the diaphragm. All right, so you're just gonna breathe in and out for me. Okay, good. And 2 on the side here. Good. And 2 on the other side. Okay, good. So when I have you face the wall over here. Okay, we're gonna do 10 spots again here. So in and out. All right, good. Okay, so all lung fields are clear, no wheezing, no crackles. And we're gonna go ahead and listen to the heart now. So we're gonna start off with the aortic, so that is on the second intercostal space on the right side. Pulmonic is on the second intercostal space left side. Herbs is the third intercostal space, and it is on the left side of the sternum. The fourth intercostal space is the tricuspid, and that's left of the sternum as well. And mitral valve, which is on the fifth intercostal space, and it's mid-clavicular. And I'm gonna go ahead and listen to the heart sounds. First with the diaphragm. And at the mitral valve, I'll listen for 1 minute for the apical pulse. And then I would flip over to the bell and just go back up. Okay, so S1 was loudest at the apex of the heart, and S2 was loudest at the base of the heart. There was no S3 or S4, no murmurs. And we're gonna go ahead and have you stand up, and you can go ahead and face the wall, and then go ahead and bend over and touch your toes. Okay? All right, so spine is straight, no S-curve, and no signs of scoliosis. You can go ahead and stand up. Okay, we're gonna do the costovertebral angle, so you can go ahead and still continue to face the wall there. And let me know if you feel any tenderness.
No. No.
No? Okay. And then we're gonna check her anterior posterior diameter. So she is at a 2:1, no barrel chest. And then you can go ahead and face the window. And then you could go ahead and do a wide stance. And arms to your side, and then close your eyes for me. So this is the Rungberg test. We're gonna check to see if there's any dizziness. We'll do this for 30 seconds. And patient passed the wrong work test. So you could go ahead and take a seat. Alright, so then I'm going to have you stand up and walk toward the couch. And then you could come back and take a seat. Okay, and then so patient's gait is steady and patient's stride is normal. And then I'm going to go ahead and check her lower extremities. Okay, so again, skin feels warm and dry again, and I don't see any lesions or lumps, and then no edema. And then I'm going to go ahead and feel for your popliteal pulse, bilaterally equal at a 2+, and your tibial pulse, bilaterally equal at a 2+, and your dorsalis pedis, bilaterally equal at a 2+. And we're going to go ahead and do the Babinski test. You can go ahead and bring your foot up. Okay. And patient passed that, so there was actually a negative test. And then I'm going to go ahead and have you lay back. We're going to do and check your abdomen. Okay, can you point to your belly button for me? So belly button is midline. I don't see any scars or lesions. Skin is normal for a race again. And I'm going to check the contour. Contour is flat. And I'm going to go ahead and name the organs in the quadrants. So we're going to start off with the lower right quadrant, which has the right ureter and the right ovary. The upper right quadrant has the liver and the gallbladder and the head of the pancreas. The upper left quadrant has the tail of the pancreas and the spleen and the stomach. The lower left quadrant has the left ureter, left ovary, and the sigmoid colon. And we're going to go ahead and osculate. Starting with the lower right quadrant. Vowel sounds times 4, and I'm going to go ahead and percuss. Timpani sounds times 4, and a little dullness over the liver, which is normal. And then we're going to go ahead and palpitate. Any tenderness?
No.
Any tenderness?
No.
Okay. And then so you can go ahead and sit up at a 45-degree angle. There was no signs of JVD, and this completes the head to toe assessment.